And your simple diagnosis might be, I feel the head moving, but this part feels like it's not moving so well. Let's call that a simple observation. And I say, well, maybe it's this coronal suture back here. Well, we can feel that. You can feel the suture on him. Is that hurting you?
No.
Because I'm not pushing that hard. Maybe it's emotionally hard on you. Is this emotionally hard on you? Okay. So if I think that this area is not moving too well, he wanted us to put our fingers across the suture and to go as far as we can on the opposite side of the head with a finger. Now certainly, electrically we do create a circuit doing this. Okay? I used to do this thing for, I used to have a lot of toys and things like that in my office I treat a lot of kids, so I have magic tricks and things to distract them. And one of the things that I would use for fun, I don't know, you must have seen this. It's a ping pong ball. And it has two little electrodes on it. So if you touch it, it lights up. Have you ever seen something like that? It has two electrodes. So if you touch the two metal parts, the ball goes, it's a ping pong ball, right? So what I would do is I would hold one of the metal pieces of the ping pong ball, and I'd touch the kid, and I would touch the kid, and I'd take the ball and go woo, 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 and the ball will light up because we're making an electrical circuit. Mm-hmm. And it's a little game to, the doctor's office is a scary place, but any doctor's office is a scary place. But this for sure is making that electrical circuit. Now Dr. Sutherland said that he believed me touching here was pulling CSF in that direction. I have no way to prove that to you. And I have no way to prove this to you, what Donna did for my patient. Which I said, because I didn't pay attention when she was, I'll work on this part, Donna, you work on the other part. Then I get down here, you go work up there. That's how we work. And my patients would tell me, that student you had, terrible. That student, very nice, very good. And she said, she just cupped the ankle like this. She didn't feel comfortable doing this, so she put one palm here and one palm. And one of her complaints for years was burning in her feet, both feet, burning in her arms. And it didn't cure it. It made it go away for a couple of days. And she said, I just imagined that, energy was going from this hand to that hand. This, in classical osteopathy, this is a V-spread. This same idea can be applied anywhere in the body. I'm not doing it with finger points, but I do this a lot now. You're getting clay between your hands, and I want it to be softer. My ultimate goal, this shouldn't be tense. He's laying down here, he's not, his tissues should be relaxed. There's no reason why Jason should be tense. So this first requires us to feel something. So what I want to do first is, before we break up, I want you to get someone you haven't worked with today or tomorrow. But we can't really predict that unless you know you're not going to work with them tomorrow. So you'll get someone you didn't work with today or yesterday, and I want you to do an OA release first, which is going to be hands under the head. And you'll see how I do this. I push here, I come underneath half, I roll here. This stops me from pulling his hair. I'm going to lift up just a little bit. I'm not going to come up on fence posts, and I'm going to lean back. This is the OA release that we did yesterday. You weren't here.
Can you do that again?
Yeah, you weren't here for this part, and we're going to help you.
Thank you.
I'm going to put my hands just under his nuchal ridge, and Alfred and I will come and help you specifically with this. And then I'm going to lift up a little bit like this, and then I'm going to lean back. And I'm going to lean one side or another side until I feel that ease up, and I'm going to keep coming rather than doing it all at once. I want you to go from there and to a frontal lift. Do this lift with your thenar eminences, do this lift here. Then come back to the vault hold. From the vault hold, don't think about anything. Is there one part of his head that feels harder to you? Or I'm going to interpret harder as moving less. If there is, I want you to say this half, front half, back half, so that we can look at coronal suture here, sagittal suture, or lambdoidal suture. Okay, the part that feels less to you, I want you to try and do a V-spread, which will be fingers on opposite sides of the sutures where you think it is. Okay?
Does it matter which hand to do the read?
No. Some people will say yes. Dr. Fulford would have said yes. Other people who I respect would have said no. You choose. You choose which general you want to listen to. Okay? But my experience is it doesn't matter. I do a lot of things with my right hand because I'm right-handed. If you're left-handed and you want to talk about polarity, you know, for whatever reason you're left-handed. So I'm going to use my right hand. And something's going to happen. I know that that ping pong ball will light up no matter how I do it. Bing, bing, and the ping pong ball joke that I did with the kids will light up. So come across the sutures and do that for a minute, 2 minutes. Come back to your vault hold and just see if you palpate a change. I'm not looking for you to find phony, fake answers between you and your partner at the table. Do you feel better? Oh, I feel wonderful, you know. That's how a course always is. I had a great time. But after the course, you're going to go back to people that have headaches, that have problems, that you can't play that, you know, that game doesn't work. You know, between that visit and the next time they see you, how's your headaches been? They've been better, they've been worse. Okay? So we're going to do an OA release, do frontal, vault hold, find either coronal suture, sagittal, somewhere in the, if you want to do lambdoidal, okay, if you're not sure of the anatomy, grab me or Alfred, okay, do lambdoidal, and then come back to a vault hold. See if you palpate a difference, not if he feels better. That's not the judge of this, okay?